Hello and welcome to Crushing Doubts Q&A every Monday, 6 p.m. Eastern, 3 p.m. Pacific. It's great to be back here with you, as always. We're going to spend time answering your questions about these three columns I'm always talking about to try to conceptualize what is happening with mind-body experience and to get you the answers you need to describe whatever is happening and what to do about it. So, guys, we're going to dive in very shortly. A couple of updates as usual. I am continuing to roll forward with the seminars and the group memberships. The group memberships are getting great results, which I'm very excited to see. Everybody's getting their moment-to-moment thinking in place, going through these moments and analyzing them in terms of the columns and what is happening. The next seminar, we've finally set the date. We were waiting to position ourselves and see when people were going to need it and get it up and running in a timely fashion so that people could get on it and sign up. That is going to begin February 7th. That's a Monday. These sessions are going to be 75 minutes long, as they've always been. They're 8 days over an 11-day period, Monday through Thursday, and that's going to be 1:45 p.m. Eastern to 3 p.m. Eastern. If your Pacific time is 10:45 a.m. to 12 p.m. So, and obviously, adjust accordingly to your time frame, whatever time zone you're in. But I'm very excited to get the seminars going. Now, there's one thing I wanted to share also about these seminars that is has an added bonus compared to some things before. And that relates to the shift in where we are going to be producing our content. I've talked about this a couple of weeks ago, but I want to update you now because I now know much more details. First of all, I made an announcement that it was going to be on something called the Spark Network, but it's actually shifting to a different name. That's going to be the Sapphire Network. It's SAFIRE. And the Sapphire Network is going to be great for multiple reasons, but included in that is it's not just going to be my content on there. We're going to have a lot of mental health content just in general, but we're going to have other content as well. And it's going to be an expanding network that's going to get into comedy and sports and lots of other things. So we're part of a bigger conglomerate, which is great for our mind-body community because it draws attention to the issue and spreads the word much farther. And that's a big part of what I'm trying to do. So when it comes to signing up for the next seminars, you're going to get free access to the Sapphire Network. Now, when I say that, I want to just let people know it's going to be incredibly affordable no matter what. It does cost something, which is different than YouTube, but it doesn't cost that much. It's a one-time membership that you join, and you get a lot of perks from that membership. So we can talk about it, but we're also going to be doing some free giveaways, and included in that is if you sign up for the February 7th seminar, we will give you the access. It's called a token, the access token free. You can access all of that stuff on the Sapphire Network. This Q&A, however, is going to continue on YouTube indefinitely. So we're always going to be there in that way. And you guys know where to find me. If you have any questions or concerns about it, you can contact me at dan@crushingdoubt.org. You also can contact Greg. He's the technical guy, so he's probably going to know even more of the answers for this. Greg@crushingdoubt.org. So again, lots of announcements here at the beginning. Sorry to get that out of the way, but I look forward to working with you in a number of regards and expanding this message. Very, very exciting for me, and I hope you guys will be excited about it too. I look forward to getting your thoughts on it. Okay, let's say a couple of hellos. Catherine Toomer, good to see you on YouTube. We've got Feel to Heal Coaching, which I think is, Put Pain in the Past is Rita. Feel to Heal Coaching is someone that Rita knows, actually, who I'm not sure I've met. But if I have, I apologize. And Scotty Styles is saying hello. Good to see you all on Instagram, on YouTube, people on Facebook. I will be monitoring your questions as well, so please bring them in. Okay, we've got a question from Sylvia Sierra. Good to see you, Sylvia. She says, hi, Dan. What do you suggest for once the pain is underway? Like when I get a migraine and it's on day 2 or so, or even a few hours in with no change or reduction in pain. Okay, there's so many great questions here, but I love this question because when you guys ask these questions, it allows me to highlight something very important, whatever it is, because we need the information. So, I see. Sorry to interrupt this answer to Sylvia's question, but the person that Rita knows is Laura, and Laura is going to be interviewing with me on Friday. So Laura, I really look forward to it. Can't wait to hear your story, talk to you, and compare notes. Excited to have you here. Thanks so much. So Sylvia, your question allows me to highlight something really important. And that is every moment is an opportunity. Every single moment. So what that means is, and I totally understand what you mean. I used to think this way too. Once the symptom has started, can I really get out of it? And it's like doubt has another way in once the symptom's been there for a while. But if you think about it, that's actually quite illogical. And I don't mean that towards you, Sylvia. I mean it towards me and all of us. We all engage in something that seems logical, but turns out isn't. And here's a way to think about it. If we think that it lasting a little while will mean that it's going to take longer to get rid of, what explains that we get rid of it eventually anyway? It's totally arbitrary. When does that symptom end or not? Now, a lot of times we could chalk it up to, well, I got sleep, or it ran its course. We make these arguments, but really it doesn't make as much sense as we are moment-to-moment beings. Our belief system can change our physiology, and we can change it right there. So what I would suggest, Sylvia, is don't treat it any differently. Recognize that this is a doubt. It's a strong doubt. It's a potentially logical doubt, but you could challenge it right there. And the more you challenge it, the better results you're going to get. So try to think about it that way, but just recognize that's doubt getting a foothold in your path. It can get in your way, and it can say, well, listen, I've been here for a while, so I'm going to be here for a while. No change, no change, no change. When symptoms don't change, it is simply doubt. And I have managed to challenge headaches in this way, in a way that I couldn't before. I used to treat headaches like once it started, it can't stop. That's the kind of messaging we get around headaches. So Sylvia, I totally empathize with you, but treat it like any other symptom. Treat it like it's some kind of flare-up of like a little pain in your elbow or something like that. Don't treat it differently, okay? Let me know if that helps, Sylvia, and we'll go from there. Okay, I see Arizona Golf has joined us. That might even be Courtney. She lives in Arizona. She's into golf. I think that might be her. I see that Rita has some smiles for us about me meeting with Laura. Thank you for sending Laura my way, Rita. I really appreciate it. EMC 9454, good to see you here on Instagram. Okay, Linda Alarde. She says, hi, I may have to pop off for a while, but I'll return as soon as I can. I hope all are staying safe and well. It's good to see you, Linda. Linda did just have a surgery on her hip. Now, that was for mobility, but if some of you have been watching, Linda and I had a great breakthrough where we decoupled the pain from the mobility. She was able to reduce her pain even before the surgery, even leading up to it. And that was very eye-opening for her and very validating for me in terms of what I talk about. Now, she said, I find pendulation, which is a kind of gentle somatic tracking, to be really helpful in checking in on pain without giving too much attention, just observing and return to breathing or safe sensations. So we all have to find, I encourage you guys all, find your system within my system. When you do the seminars, I give you the basic information that's meant to condense all of that mind-body information into one centralized area so you can know, I don't need to keep going and searching for things. But then you're going to need to find your answers. What are the things that work for you? And this is an example of what Linda's talking about. There's all kinds of different techniques. I'm not saying one is better than the others. You have to think about what works for you. And in this case, Linda is finding this gentle somatic tracking called pendulation, which I had actually never heard about, but it sounds familiar based on some other things I know. And this is allowing her to not give it too much attention, just observing and returning to breathing. That's working for Linda. Linda, you keep it up. She says her hip is doing great. Thanks. Glad to hear it, Linda. That's fantastic. Leslie Plotkin Buchanan, good to see you on Instagram. Thanks for joining us. Okay, Rena or Raina, I hope I'm pronouncing at least one of those right. I was going to say Rena. I'm going to go ahead and throw down on that one. You let me know if I have it wrong. She says, hi, Dr. Dan. I was convinced mind-body work could help me because I had an infection which cleared with antibiotics, but I still have lots of symptoms. But what about stealth pathogens? A naturopath told me this was the reason why I have continued symptoms, not mind-body. Okay, so Rena, or Rena, please do let me know if I'm saying your name wrong, but that's probably hard to do in writing. The thing I would say, because I don't know the specifics, I'd need to find out more. Like I say to people in my program in general, ask your questions. So in this case, I would ask you this question. And the question is, okay, well, what what is this naturopath saying is causing it? It sounds to me like her theory, it relies on a kind of randomness. There's no clear explanation of it, so I'd want to hear more. I am very, very firmly in the camp right now, in terms of what I've heard you say so far, that this is very mind-body, because it's behaving exactly like a mind-body process. Now, I don't know much about stealth pathogens and why that would continue symptoms. That seems like it would be a very rare thing. It doesn't make a whole lot of potential logical sense. So the fact that it fits with mind-body so well suggests to me this is mind-body. And I don't throw this around, carelessly. I say, go ahead and get checked out by a doctor. But the fact that the infection was actually cleared means you're not in real danger. Assuming that is the case, that you've gotten it checked out with a doctor and you are not in real danger, you can assume this is mind-body 100%. And I would go after it that way. This idea of stealth pathogens is the kind of thing that people say, and I don't mean it critically of this person, but I think that they don't understand what's happening in the mind-body experience, so they have to find some kind of quote-unquote structural diagnosis that explains it. And they're really grasping at straws. And you can see how their theory doesn't really match up very well with the mind-body theory. If you line up two theories together and one crumbles very easily or seems very random while the other explains everything and fits with everything we know, that says something. So, Rena, I would say this is mind-body 100%. And as long as you're not in any kind of danger from a medical perspective, and doctors say that, then you're fine. Now, she says as a follow-up, no one can give me a clear answer. I've been to 10 or more doctors, and they keep saying my urine is clear, no bacteria or anything else anymore. I have frequent urine, etc. Okay, Rena. Well, I can give you a clear answer. You have TMS. This is mind-body 100%. You've been to 10 doctors. Doctors are really good at finding things. So they haven't found anything that is medically dangerous, and that means you're totally safe to treat this like a mind-body experience. What you're describing is 100% in line with mind-body experience. The idea of stealth pathogens is 100% in line with the kind of random structural issue that people say, oh, there's this going on, or there's this going on. Well, guess what? That doesn't explain much. It's totally random. It is saying to you that you are having some experience that other people are not having, which doesn't fall in line with what we know. People work like they work. The mind-body process works the same in everybody. And that's what I love about the column system, is that it can explain it. So, Rena, if it's helpful, I give you my guarantee. This is mind-body. Let's talk more about it to get you clear on it. But if you want to talk more about it, please do contact me, dan@crushingdoubt.org. I can take you through my whole system. In fact, if you want to take my seminar, it's a great lead-in to show you why I'm as definitive as I am. So let's talk about it. Okay, I hope that's helpful. Okay, I think I missed a question. Let me just jump up. Okay, Molly Miniatures and more. Okay, you're making other things, Molly. Acid reflux to me is the same as headaches. I tell myself it will go away, and of course it always does. Also, I know now not to eat later at night. Okay, so the interesting thing is that eating later at night may just be a trigger, Molly. I'm not saying it is or it isn't, but we need to look out for that kind of thing. I agree, though, and I said I would agree, but I didn't say what. So acid reflux being the same as headaches, I agree with that, but I agree even more than that. All symptoms are the same. This is the way we need to think about mind-body symptoms. It doesn't matter what the symptom is. It doesn't matter how it presents. The fact is, the mind-body process works the same for everybody, and it plays out in the same way, completely predictable. And this is one of the things I love about the columns. If you hear the explanation of the columns, it's more logical, it fits with the science, and it doesn't miss anything. It can predict exactly how it's going to go. I shouldn't say that. It can't predict how it's going to go because I can't predict your mind, but I can understand how, given what your mind was thinking, it went in that direction. So it's a way of interpreting what's happening and making sense of it all the time. I say this many, many times. The only assumption I ask you guys to make is that you make sense and your symptoms make sense, and it is always true that it makes sense. Let's keep working at it. Okay, Sylvia says, thanks, Dan. Very helpful as always. Glad to hear it, Sylvia. I have thought of it before in terms of just treat it like any other pain. This AM, I had some ear pain, but was assured it would pass. Need to apply the same to the migraine. Exactly. Listen, Sylvia, this is a symptom that doubt knows it can hide it. It knows it can kind of get you there, and that's why it does it. But that's all the more reason to challenge the doubt ferociously there. The only reason that symptom is different is because your doubt is different there. And this is something I like to say to people a lot of the time. You can't tell the difference between a symptom being different because it is different or because there's some kind of problem versus a symptom is different because your belief system about that symptom is different. You can't tell that apart at first. You need to look at it. And if you spend some time looking at it, what you're going to see is that your belief system is always the determinative factor in mind-body symptoms. And since mind-body symptoms relate to, I would say, 99.5% of all physical events, this is a big deal. So keep tracking the fact that it always has meaning. It's only about your belief system. If a symptom is stronger, you just have more doubt there. Or maybe the emotional column is kicking up there, but it's connecting there because your belief system is different. Okay, Mark, good to see you. I do want to mention something, actually. Mark brought this to mind because Mark is thinking of leaning towards doing some of my trainings with me, and I wanted to say this to you guys as well. This is another, I guess I would say, service that I offer, but it's also just building the network of what you all need. I'm training different practitioners of many different backgrounds. You don't have to be a therapist to do this, but you can train in my system. I do these trainings. They are 14 sessions over a 14-week period. They're hour-long sessions. They train you in the entire column system. Now, if you are interested in doing the training, but maybe can't afford that and the seminar or something like that, well, guess what? The training gives you a lot of the information that the seminar gives. It really compacts all of that together, but it gives you also the training to go ahead and do that. And then you're part of my referral system. And I need that because so many of you come to me and need help of various kinds and maybe at different cost levels. We've got to keep building that. So Mark, I'm excited to work with you on that. If anybody's interested in joining me in the next training, we're looking on getting that going at the end of this month or the beginning of February. So you know where to reach me. It's dan@crushingdoubt.org, or you can contact Greg at crushingdoubt.org. Okay. But Mark, good to see you. You spurred that whole thing just from seeing your name. Really good to see you. By the way, Mark did a video with me telling about how he got better just from the podcast. We had no interactions other than just the podcast. And he got all better from his mind-body symptoms, and now he's ready to take it and run with it. So I'm really excited. Okay, yes, can't wait to start, Mark. We're going to get you started as soon as we get the group together. It's coming together nicely. Okay, I'll keep you posted. Molly says to Linda Larde, breathing using the visualizing the square method helps me a lot when I feel stressed. So this is another thing. See, I don't know about this. There are so many methods, but the reason I don't tend to worry too much about which method is because it's actually all the same in a way. It's all accessing how are you going to alter your thinking, your feeling states, and your physiology ultimately, even with like breathing, by these different techniques. But you guys can be helpful to each other, comparing notes, saying, oh, I did this. Go ahead and do that. Build it into your system. That's part of your system within my system. My system is about how to understand what is going on. What to do about it, I have that in my system too. I have action steps, but there are other things that you can do. They fold right into the system. One of the reasons I love the columns, it doesn't reject all that great stuff that's out there in the mind-body field, and there's a lot of it. It takes the best of it. It makes sense of why it fits. So we're going to keep that up. All right, Catherine Toomer says, chronic nausea is better. That's fantastic. That's a good thing. Plantar fasciitis still presents after long walks. I think the problem is a tiny bit of doubt, but I sense too that I am afraid of power. Okay. She has a second part of this, and I see that's up there. So good job, Courtney, catching that. Leave it up there because I want to answer a bunch about this. She then says, I also have had restless leg syndrome since I was very young. Working with it as TMS has helped some. Restless leg syndrome, by the way, always TMS, 100% of the time. What would you suggest I do when I wake up in the middle of the night with extreme jumpy legs? Okay, I'm going to get to that, but there's so much in here. So again, please leave this up here. The first thing I'll say is this. Every symptom that you have, whatever, if it's chronic or what I call consistently acute, meaning always there, but actually just moment-to-moment experience that can be gotten rid of right away if you think about it the right way. Not that's easy, but it is that simple. If you've got a symptom that's lasting longer, the doubt is longer, just like I said with Sylvia and the headaches. So it seems like, Catherine, you've gotten past the nausea part. You have less doubt there. You've still got some lingering doubt with plantar fasciitis. You said that you nailed it. You said, I think the problem is a tiny bit of doubt, but you also sense that you're afraid of power. Okay. Now, as people work in the columns, what tends to happen is this. People get a good sense of their emotions column. Sometimes they even come in with a good sense of emotions because they've done a lot of therapy work, or they've read Sarno, or they've talked to Nicole Sachs, or all kinds of things. But they've gotten used to the point where they can often use the emotions column to decent effect for acute symptoms. But the chronic symptoms are giving them a lot of trouble. And that's because they're being asked in much of the mind-body world to keep applying emotional thinking when that actually doesn't really necessarily apply once you're getting into the supposed chronicity of things. What happens is there's a flow to the columns work. People come in thinking a lot about the emotions. Once they get to thinking about doubt, they can remove that chronicity and return to using that emotions column to even better effect, reducing the doubts, and then it all starts to move towards power. And what I found is very interesting. We're finding this in the groups a lot. Everybody is moving towards power, but once you get close to power, some people, in fact, a lot of people, are afraid of power. They're very, very worried about it. It means changing their roles. They're not sure how everybody will respond. It's very high stakes, actually. It scrambles everything, or at least it seems like it's going to. It ends up being a wonderful thing if you can do it. But a lot of times people need to be walked through that a little bit, or given a sense of what it means or why they don't have to be so scared. And I am going to get to the restless legs in a second. But in the group today, we were talking about just this, that it's very, very frequent that as people are starting to get too close to power, doubt starts to kick in to try to keep you from getting to that power. So good observation, Catherine. You're right on, and we can talk more about it. If you think it would be helpful, I'm not meaning to pressure anyone, but the groups are doing great work. So you can sign up on the website. It's www.crushingdoubt.org. So it's a great place to work through these kinds of things where we have to change roles. We have to change how we're thinking about things. I see Susan Reynolds says, yes, this, what you were talking about of changing roles in the family. And I see your question, Susan. I'm going to get to it in a second. But there's a lot in there. This is big. This is the work of therapy. People go to therapy for, 20 years sometimes more. And this is what they're seeking. And the great thing about the power column is it provides a recipe for getting to that, at least for seeing the problem, so that you can decide what you're going to do about it. I'm going to get to that in a second, but let's get to this restless leg syndrome question. Again, restless leg syndrome, this is one of those things that is 100% of the time, always mind-body. What's happening is you've got this pent-up energy related to certain things, and you're basically running in your sleep. You're twitching, and it's like you can't keep it still. So here's what I would suggest when you wake up in the middle of the night with extreme jumpy legs or restless leg syndrome. Now, the way I think about this is that is an onset or an uptick in a symptom. And I stay to the same rules all the time. They always apply. The onset or uptick in symptoms is always emotions column. So what's happening is, without realizing it, it's probably completely unconscious, you are having some kind of emotions column experience. And what I want you to do, if you've done your mind-body map, is to go back to it or go back to it in your head and think about all the themes and think about what applied today, tonight, in the moment. Now, of course, if you were sleeping, you're going to think, well, I don't know what was happening in the moment. If you remember your dream, though, that can lead to a restless leg. Try to think, though, about, well, what was happening in the hours before bed? Because those were the moments that brought you into the sleep cycle. And when you go into sleep cycle, everything that was with you then comes with you, and your brain continues to work on it. So If you are working on this kind of thing, you can try to get to the theme. If you're not finding that you can get to the theme, Catherine, I would actually suggest get up and do something else just for a little bit. Let your mind go. Maybe you meditate for a little bit. You could do that. You could even watch a show. You could read a book. But I actually suggest physically getting up because it kind of signals to your legs, okay, yeah, I got the message. Something's bothering me. I understand. I'm on it. As soon as you're even thinking about it, the symptom can kind of die down and not need to be as present. Okay. Long answer, but hopefully helpful. Okay. Now, Sylvia said, Molly, I'm the opposite. My GERD symptoms are much better. If I ever get burning, I stay calm, may take some baking soda and water, and mostly just stay calm even without treatment, and it passes. And Molly says the water and baking soda does help a lot. That is what I do too. Okay. And then there's one more part of that discussion. Then Molly said to Sylvia, but yes, that triggers me more than a headache. It's all about what triggers you, right? You know, different symptoms capture the imagination. When I developed back pain, part of what happened is it scared me. I had other symptoms before then. Why didn't they become chronic? Because I wasn't scared. They didn't bother me. I wasn't like, I've heard about people with herniated discs and how that causes back pain, which we now know, of course, is complete nonsense. But I had heard it from everywhere, and I was worried. I was like, what if that happens? Then I won't be able to move around. Whatever captures your imagination in the negative way is likely to give you symptoms. Meanwhile, whatever captures your imagination in the positive way, you can use in the power column to expand your life and do lots of fun things. Okay, Megan Bay Dorman, good to see you on Instagram. Thank you for joining us here. All right, we have a question from Susan Reynolds. Susan says, I'm curious, in the power column, do you have to heal past trauma and talk to family about things you still feel angry about if the old patterns of behavior continue and they keep rejecting you? I ended up breaking contact with my parents, but my father keeps messaging and wants me to reply, but I'm too angry to talk and want to heal first, or is confronting the parents part of healing power? Okay, let's leave this up here. This is a very powerful one related to the power column, not a surprise. But Susan, great question. And I have a definitive answer. Now, this is something that I think is part of the appeal that I sometimes have for people, is that I do have very definitive answers about this. And I have reasons for having definitive answers about it. I'm happy to talk with everybody about it. You do not need to confront the parents. You don't need to deal with the past trauma in a way that is an interaction with them. There's only one person you need to deal with. It's you. And I have specific ways to do that in the power column. So creating the core narrative, it allows you to see yourself much more clearly, I find, than I got in therapy. It allowed me to accept really the fullness of my trauma, because a lot of times I wasn't doing that. I was accepting kind of some light version of it. Accepting the fullness of your trauma means you really see it, and it'll hit you like a ton of bricks when you get to it. But you don't need to process it with someone else. And you certainly don't need to process it with the very people who caused the problem in the first place. To me, that would just be reenacting the experience. It's likely to be setting you up for a really upsetting thing. Like you said, they keep rejecting you. And the fact that you broke contact with them, if anything, it should tell them something. You know, it takes a lot for somebody to not want to talk to their parents. People don't want that. I know you don't want that, Susan. They forced you into that because they weren't responding. They weren't adjusting with it. You do not need to process anything with them. What we need to do is get you your core narrative so that you see you very clearly and start to track when you feel in power or not, and start to get you some of those action steps about how are you going to get into power then. Okay, let me know if that's helpful. But it's one of the reasons I love this work. And I'm really excited to get the book out to you. Just an update on that. For those of you who hadn't heard, I was able to finish the rough draft of the book. I'm now done. I call it pre-editing because I was thinking about this. I can't just send it to an editor and be like, okay, how does it read? Because it's my own theory, there's only one person who can pre-edit it. I have to go through it and make sure that everything that I need in there is in there. So I'm in the process of doing that. I'm through 11 of the 16 chapters. I'm cruising through it. There's a little bit more to get to, but I'm hoping to finish the edit, planning to finish the edit Notice I caught, remember I say, be specific about your language? No, I am not hoping. I am going to. That's a very different experience. I'm going to get the edit done by the end of this month, and we're going to be talking about how to get the book out to you, we are hoping by April. Look on our website, www.crushingdoubt.org, and that's going to help you know the timeline of that. You'll even be able to pre-order the book. And I'm so excited to get it out to you guys. It's really, it's been a lot of work, certainly, especially because I want to get it to be as good as it can and should be. And the longer I took to write it, the better it got. But it's time to get it out there. So I'm really looking forward to it. Okay. Hi, Napoleon. He's saying hi on YouTube, and he also joined on Instagram. So got you in both places. Okay. Catherine Toomer says, wonderful help, Dr. Dan. I often think I should force myself to stay in bed and not run away from the jumpy legs, but it's torture and I dread it. So I'll try your suggestion. I'm excited to do so. Okay. Absolutely. Don't stay with the symptoms. Don't stay in the situation where the symptoms just get to keep doing the same thing. Go change it. Change it up. Push the symptoms around. And sometimes people think of that as, oh, I let the symptoms push me around. It's actually the opposite. You said, all right, I hear you. Remember, Sarno talks about symptoms as a distraction from whatever emotional experience is being buried. It's also a communication. And I'm not saying Sarno didn't say that, but I don't think he didn't emphasize as much as I do. It's a communication. So hear the communication, change the situation. Go ahead and do it. Your body's telling you must do something different. If you keep doing the same thing, not going to be fun, and it won't help you. So I'm glad that helps. Okay, Susan Reynolds says, I love definitive answers. Part of me feels like I'm avoiding, which is kind of a life pattern. Yet at the same time, I don't want to get hooked back into family dynamics. Reenacting is exactly right, but there is family stuff. His sister and brother both died recently. I see there's a whole conversation happening here. Hold on 1 second. I missed that. Okay, let me just say this, Susan, though. You're not when you make a decision, a more positive decision to move on with your life and not let people who have been toxic to you continue to have interactions with you, that's not avoidance. That's action. Avoidance is actually when you just go ahead and keep doing the same thing because you're afraid to move. You're afraid to change something. Believe it or not, that's the avoidance. So you're not avoiding. You're doing something really big and good and very powerful. So more power to you. I'm proud of you. Molly says, I had to detach from my family, siblings, that is. Sometimes it's the only way. And listen, this is something that can be very hard for lots of people, but I see it again and again and again. We talk in society as if family is so important. And family is very important if they're good to you. But if they're not good to you, then who cares? Why do we have to be slaves to our family life when they're not even good to us? I have people in my life who are much better to me than a lot of people in my family. And you know what? If my family wants to adjust it, they can. Nothing's stopping anyone from having a good relationship with you. If you're trying and they're not doing it, that's on them. Okay, let's read some more comments. This is a big theme, and I see we're talking a lot about that. Susan said, I feel more in power when I'm not in contact. Thank you. Absolutely. Yes. And you should be allowed to do that. I think I need to look at one of your groups. Susan, you would get so much out of this. Let's talk. Send me an email, dan@crushingdoubt.org, or go to the website, www.crushingdoubt.org, and you can just sign up for the groups. It's going to make a big difference for you. And meanwhile, they're very cost effective. You can join once, twice, or 3 times a week. I do take a week off each month, so it's actually 3 meetings, 6 meetings, or 9 meetings, but they're really worthwhile, and you get to go through the columns. So Susan, come join us. I would love that. All right. Molly says, it is hard when there are deaths. My parents both are now gone, so I could detach. It's interesting because I think some people have an easier time detaching when the deaths have happened, because of course it's now past. And then some people actually find it's harder when the death happens because they feel like, well, now what am I supposed to do? But you can always do something within you. So remember that no matter what's happening. Then Susan said, it's hard when there are time-sensitive things. One of his siblings died this week and another just before Christmas, but I have nothing to say or add, and I need to protect myself from him dumping on me. he tends to dump all his family stuff on me. Protecting yourself is a good thing. It really is. You don't have to do it in a way that is aggressive or makes you difficult or takes you away from the goodest path, because we need more goodists in the world. But channeling your aggression, being fiercely in your own corner, accepting the fullness of your trauma. These are all things that I pose in very stark terms for a reason, for multiple reasons. But one of them is I have to show you just how important it is to protect yourself and just how much you have not been protected. I can pretty much guarantee you, just by virtue of the fact that you guys have mind-body symptoms, you haven't been protected enough in your families, maybe with your friends, in the world. So let's have you be on your own side finally, and I'll help you do that. Okay, Scotty, I see your question on Instagram, and I see Move with Deb is here as well. Welcome to Instagram. So Scotty says, now that the pain is gone, awesome. I'm having unnecessary repetitive thoughts, and I know this is anxiety. So not awesome, but symptom imperative. It's moving along. What strategy would you suggest to quiet the repetitive thoughts? Is this OCD? Just did some Wim Hof breathing, and I feel more relaxed. Okay. Breathing is always helpful. Calming down your central nervous system, fantastic, sure. But here's the thing, Scotty, and for everybody else out there, don't think of any symptom different at all. So kind of obsessive thinking and repetitive thoughts, don't think of that as different than a headache or knee pain or gastrointestinal problems or blurred vision or itchiness or rashes. I want you to think of every symptom as the same setup, okay? If you start to do that, just like I was talking about with Sylvia, you get to challenge that symptom and not let doubt rest there. Doubt is now resting there. That's why it moved there, Scotty. It found a place where it could rest, right? It's always going to look for that sort of thing. So look for the symptom imperative and where it goes based on who you are and what you're believing about those symptoms. I hope this is helpful, Scotty, and you let me know, but you said, what strategy would I suggest to quiet the repetitive thoughts? I think trying to quiet them is in a way giving them power. What I want you to do instead is think about them differently. Think about what they're saying. Think about them as another kind of symptom. All right, let's start there. Let me know if that helps. Okay, now let's see. I'm having trouble managing the conversation because it's flowing, but it's good. It's good for you guys to talk to each other. I'll read what I can here and get back on the horse here. There's thanks for kindness and support between Susan and Molly. So keep up the good work. And by the way, if any of you want to connect with each other, just get me your information and I'll provide that link if you ever are looking to connect with a particular person who you find is helpful to you. Okay, Linda says, I have found that recovering from this hip replacement has shown me how much my perfectionism and people-pleasing had set me up not to care for my own needs ever. Yep. It's really interesting. We get a very striking view of that sometimes, and it's very important. I know what you mean, Linda. I've found that across the board. Wow, I wasn't taking care of myself. Didn't realize it. Now, Sylvia says, Susan, just prioritize yourself and your needs and power. Yes, I love that, Sylvia. You don't need to worry about how your father is doing or feeling and let that guilt you into talking to him. I could not agree more. Sylvia's message to you, Susan, is perfect. This is part of how they keep us out of power, is through guilt and the old ways of kind of twisting things and making us, they even use our empathy against us sometimes. I'm not saying that's happening specifically in your situation, Susan, but happens all the time. All these good qualities can get twisted around and used against us. So we need to be careful about that and protect ourselves. Okay, so Susan says, we live in different countries, so I can keep distance between us. Listen, they drove you away. So Susan says, wow, thank you, Dr. Dan. I thought it was avoidance to walk away. Nope, it's completely the opposite. And I understand why you think that, because that's how society might label it. But the fact is, it is avoidance to keep doing the same thing out of fear. To do something bold and new, like walk away from your family, wow. You should be impressed with yourself. That's not easy to do. And I applaud you for your bravery and for honoring yourself. And sometimes the symptoms are the things that tell us to honor ourselves. Okay, Linda says, having this mandatory rest and repair time has shown me how much self-care I neglect. Okay, yes, this theme, isn't it amazing? And now I have to remember to self-care as I recover and resume my normal life. Very good point, Linda. So when we get these realizations, I recommend writing them down somewhere, some kind of organization about realizations of things, and to keep them in mind, because we're going to forget some of them potentially. The great thing is the columns set up the structure so you won't forget, because you're still doing the work and you'll get back to it. The power column alone is a reminder to take care of yourself over and over and over. So keep at it. Good job, Linda. I'm glad you're on the mend. Molly says, but family is not just siblings or even parents. It can be friends, your children, and more. Yeah, listen, I've had supposed fallings out with certain friends and things like that. The reason I said supposed is I don't actually think of them as fallings out anymore. I was there for them. I would still be there for them. They left me. But I was the one who had to do the actual leaving, because they were perfectly happy to continue doing the same destructive things. And I wasn't. Hope that's helpful, guys. Let me know. Bob says, I feel I have more COVID fear than most people seem to have. Could this be TMS? And if so, how to lessen the fear? So as I said, every symptom is the same. So yes, I do think this is a form of TMS. At the same time, the way you need to think about it is whatever symptom you're going to have in TMS is going to grab on to whatever speaks to you most. So the fact that you are afraid of COVID is why it's grabbing on there. So what I want you to do is, there's a couple things, Bob, and this might be a longer one, but we should connect more if you want to know more about it. Again, you have my email, but it's dan@crushingdoubt.org, or come back on and we can get into this earlier in the Q&A next time, or in the comments, wherever you want to do it. If you want to come to the group, I can do that there too. But the thing I want you to think about as a starting point is, first of all, I always say when it comes to doubt, you've got to get it articulated. So figure out what the fear is. Is it about mortality? Is it about being isolated? Is it about the mystery of it? Is it about the fact that it will trigger all sorts of worries because you don't know about how it will unfold? Try to get specific about it. Okay, so that's one part. Secondly, don't overinterpret it as something other than TMS. It is simply that. And it happens to be where it's manifesting. What I want you to do instead, if you can, Bob, we're going to need to talk about this because I need to know where you're at with things to know if this works. But the antidote to fear is often found in the power column. And I did a podcast on this about the antidote to fear is love. Find the things in your life where there's love, Bob. Find the people who appreciate you, care about you, value you at your core. And then I want you to be one of those people. Ultimately, if you can do that, this fear will actually melt away. I know it may not sound like that would be the case because it's not addressing anything in relation to COVID, but listen, I don't know what your vaccine status is, and there's no judgment in any direction on that. But if you do happen to be vaccinated and boosted, you don't have much to worry about. If you are unvaccinated, we can talk about that because you are in some more danger from a biological standpoint, but there's still probably a lot of fear that you could get past. I think people are having a very hard time with COVID, and it makes sense. And they're having a hard time with it in multiple ways. I'm just having a hard time with it in terms of the isolation and how long it's been. It's been a slog, very hard. And we need to give ourselves, speaking of self-care, like Linda was talking about, we need to give ourselves a lot for that. Now, Susan says, Sylvia said, Bob, I'm afraid of COVID too, with good reason, in my opinion. And then Susan said, I'm the same with COVID. I read everything about it and know all the facts and ways to catch it and long-term effects, et cetera. It scares me big time, and everyone else seems like it's no big deal. Okay, so first of all, the things that we read, it's totally okay to read, but just keep in mind, a lot of people are transmitting their fear to you. And so take it with a little bit of a grain of salt. Some fear of COVID is very logical and reasonable, especially if you're not vaccinated. There is more of a danger. This whole thing has been scary. And meanwhile, my kids had COVID over the break, and I developed mind-body symptoms. I got chest pain. I got some shortness of breath. This would be the pot calling the kettle black for me to say, oh no, it's totally nothing to be afraid of. I was afraid of it when it got close to home. So a lot of people who are denying that fear are actually denying it to keep it away. We're all afraid of this. And okay, so Susan said, but my fear is quite extreme because I read all the medical journals. And so I would say, Susan, all right, I hear you. Maybe you want to tone down that reading just for yourself to protect yourself. And you also need to remember these medical journals, they report lots of different things. I don't know what you've read, but in my experience, based on what I know about mind body, long COVID is TMS, 100%. It's not going to do you any lasting damage. The danger is in the infection, especially if it's with the respiratory kind and you're not vaccinated. That's really the main danger. Now, me saying it isn't going to change a thing if you don't believe it. But let's have discussions about it. Let's not be afraid to talk about it. That's how we get some relief from these things. Okay, there were a couple more comments I just wanted to read before we wrap up. Susan, you did say spot on, Dr. Dan. I haven't been protected. Thank you. You're welcome for that. You absolutely haven't. And let's work on it. Come to the groups. You seem like you'd be a great fit for it. Susan said to Sylvia Sarah, I'm going to screenshot this, and what she was referring to is this statement. I still feel like I'm getting pain when I do too much, in quotes, or get too stressed, in quotes. It can be hard to relate that to specific emotions. Just remember, Sylvia, that's one way of thinking about it is that's just different thinking. If you're thinking in a different way, it can lead to more symptoms or it can alleviate symptoms. It's all moment to moment. All right, Sylvia says, love that, Susan. I've had similar issues, but with a great therapist and people like Dan, thank you so much. I figured a lot of the family stuff out. Always prioritize yourself and your needs. Absolutely. Listen, it is incredibly important that you, I know it sounds maybe corny or cliche, you have to love you. And if you don't yet, that's okay. The power column and the core narrative and all that, it'll help you figure out how to love you. It'll help you recognize, whoa, look at what I've been through. Okay, now Bob said, well said, I get that, I'm vaxxed, very safe. I'll get more specific in doubt on it. Okay, that sounds good, Bob. I'm glad you're vaccinated just because it's a protective thing. No judgment one way or another in general. But it's great to get people protected. And I know it alleviated a lot of stuff for me. My kids had COVID. I was boosted. And I didn't even get COVID. And I was in a car with the one who was actively having COVID at the time for 8 hours. Still didn't get it. Sylvia says, Susan, I read a lot too in the medical journals. The long-term heart issues are what scares me the most, but still that's rare. And especially if we are vaccinated, boosted, we would probably be fine. That it really is the case. I know there were those issues in the unvaccinated, and that was really scary. But largely we're at a much better place now, and I'm glad to hear it, and I'm glad to know it. And thank you so much for joining me, everybody. Just a couple quick reminders on the announcements I said at the beginning. We've got a new seminar that will be starting Monday, February 7th. They're Monday through Thursdays. It's 1:45 to 3 p.m. Eastern, which is 10:45 a.m. to 12 p.m. Pacific. That will be the weeks of February 7th and then the week of February 14th as well. With that, you do get free access to our new network, which is called the Sapphire Network, SAFIRE. I'm going to announce more about that. Ways to access it. There is a one-time fee to join it. It's not particularly expensive, thankfully, and we're going to be doing some giveaways too. So if you have any concerns about having access to the content, which I'm going to keep pumping out, it's been a little slow of late because Greg and I are doing some reorganization of things. We're going to get back to it and keep that information coming to you. Sylvia said, thank you, Dan, and all great conversations tonight. I agree, Sylvia. Thanks so much. And from Facebook, Ryan Edson said, thank you for your comments on COVID, Dan. I agree, and what you said is helpful. I'm glad to hear it. Thank you, guys. I will see you same time next week. Keep up the good work. Keep working on your columns. If you need my help, come to the groups. We work moment to moment, up to 3 days a week. You can get all of those moments in and learn your columns. Okay, Shannon Reynolds-Human. I see you on Instagram. You joined right at the end, but I did want to say hi to you. Okay, thanks, guys. I will see you next week. Thanks so much. Take care.